What are the key components of a quality control program for imaging equipment, and how should a radiology department implement these components to ensure optimal performance? Answer: a comprehensive quality control program for imaging equipment consists of several key components. Regular equipment calibration. Equipment must be calibrated periodically to maintain accuracy in imaging. Calibration schedules should adhere to manufacturer recommendations and involve testing against known standards. Routine maintenance. This involves preventive maintenance practices such as cleaning, inspecting, and servicing equipment to reduce breakdowns and prolong lifespan. Guidelines from organizations like the American College of Radiology (ACA) and the Radiological Society of North America (RSNI) should be followed. Image quality assessment. Techniques such as the use of phantoms to evaluate contrast, sharpness, and spatial resolution should be employed regularly. This assessment should be documented to identify trends or anomalies over time. Training of personnel. All staff should receive training on quality control procedures and the importance of maintaining standards to ensure compliance. Incident reporting and follow-up. Any incidents related to equipment performance should be reported using a standardized procedure allowing for timely interventions and corrective actions. Describe strategies for minimizing risks to patients during radiological procedures and the importance of incident reporting in maintaining patient safety. Answer: to minimize risks to patients during radiological procedures, the following strategies should be employed. Use of protective equipment. Ensure that appropriate shielding, e.g. lead aprons, thyroid collars, is used to minimize radiation exposure to sensitive organs. ALAR. A principle. Adhere to the ALAR as low as reasonably achievable. Principle to limit radiation doses. This involves optimizing imaging techniques to achieve diagnostic quality while minimizing exposure. Patient screening protocols. Implement thorough patient history and screening procedures to identify contraindications or allergies, e.g. to contrast agents before procedures. Education and communication. Educate patients about the procedure potential risks and the importance of cooperation to ensure their comfort and safety. Incident reporting procedures. A robust incident reporting system should be in place. This allows staff to document and analyze adverse events or near misses, fostering a culture of safety and continuous improvement. Following the National Patient Safety Goals (NSG) set by the Joint Commission can help in establishing these protocols. Mr. Tanaka is a 65-year-old patient scheduled for a CT scan. Upon reviewing his medical history, you notice he has a history of chronic kidney disease. What steps should you take to ensure Mr. Tanaka's safety during the procedure, particularly regarding contrast administration? Answer: in the case of Mr. Tanaka, the following steps should be taken. Assess renal function. Before administering any contrast agent, it is essential to assess renal function. This may involve obtaining a recent serum creatinine level or conducting a GFR glomerular filtration rate calculation. Consultation with radiologist. Given Mr. Tanaka's chronic kidney disease, consult with the radiologist to discuss alternative imaging options that do not require contrast or to evaluate the necessity of contrast-enhanced imaging. Hydration protocols. If contrast administration is deemed necessary, implement a hydration protocol before and after the procedure. This can help flush out the contrast and reduce the risk of nephrotoxicity. Use of low-osmolar contrast media. If contrast is to be used, opt for low-osmolar or iso-osmolar contrast agents, which have been shown to be safer for patients with compromised renal function. Informed consent. Ensure that Mr. Tanaka is fully informed of the risks associated with contrast administration, allowing him to make an informed decision regarding the procedure. Explain the significance of adhering to national and international standards for quality assurance in radiology departments. Answer: adhering to national and international standards for quality assurance in radiology is crucial for several reasons. Patient safety. Compliance with established standards reduces risks associated with imaging procedures, thus enhancing patient safety. Standards provide protocols that minimize radiation exposure and improve the accuracy of diagnosis. Quality of care. Standards such as those set by the ACR and RSNA promote consistent quality across radiology practices, ensuring that all patients receive high-quality imaging services. Legal and regulatory compliance. Following standards helps radiology departments comply with local regulations, reducing the risk of legal issues and penalties. For instance, the Health Insurance Portability and Accountability Act (HIPAA) mandates the protection of patient information. Accreditation and funding. Many facilities must comply with standards to receive accreditation from organizations like the American Association of Medical Colleges (ONC) or to qualify for funding from governmental bodies. Discuss the techniques used for evaluating image quality in radiology. What specific criteria should be assessed during this evaluation? Answer: evaluating image quality in radiology involves several techniques and criteria. Contrast resolution, assessing the ability to distinguish between different densities in an image. This can be evaluated using phantoms that contain objects of varying densities. Spatial resolution, determining how well an image can depict small structures. This is typically assessed using line pair phantoms to measure the number of line pairs per millimeter that can be distinguished. Noise assessment, evaluating the amount of graininess or unwanted fluctuations in the image. A common method is to measure the signal-to-noise ratio (SNR), where higher values indicate better image quality. Uniformity, checking for consistent image quality across the entire imaging area. This can be assessed using a uniform density phantom to ensure even exposure. Artifacts identification, recognizing and documenting any artifacts that may compromise image quality, such as motion artifacts or beam hardening. Regular assessment using these criteria ensures that imaging equipment operates at optimal performance and adheres to the guidelines set by professional organizations such as the ACR. What elements should be included in a quality assurance program within a radiology department to ensure compliance with best practices and standards? Answer: a quality assurance program in a radiology department should include the following elements: policy and procedures manual, a comprehensive manual outlining all quality assurance processes, responsibilities, and procedures to be followed by staff. Quality control procedures, establish standardized protocols for routine equipment checks, including calibration, preventive maintenance, and performance testing. Training and education, continuous education programs for staff on the latest techniques, technologies, and standards in radiology practice. Monitoring and evaluation, regular audits and assessments of both equipment and procedural compliance with established standards. This can include peer reviews and self-assessments. Incident reporting system, a clear process for reporting, analyzing, and addressing any incidents or near misses in the imaging process, following guidelines such as those from the National Patient Safety Foundation. By implementing these elements, radiology departments can foster a culture of safety, quality, and compliance with national and international standards. Explain the different techniques used for evaluating image quality in radiology and how each technique contributes to the overall quality assessment process. Answer: the following techniques are commonly used for evaluating image quality in radiology. Phantom testing, utilizing phantoms to assess various aspects of image quality such as contrast and spatial resolution. Different types of phantoms, e.g. water tissue simulating, can be used for specific evaluations. Visual grading analysis, trained radiologists evaluate images based on subjective criteria such as clarity, sharpness, and contrast. This qualitative assessment provides insights into the clinical usability of images. Digital image processing analysis, employing software to analyze images quantitatively, assessing parameters such as histogram analysis for brightness and contrast. Noise measurement, quantifying image noise through metrics such as the contrast-to-noise ratio (CNR), which helps in understanding the impact of noise on image quality. Response function measurement, evaluating how well the imaging system responds to a known input, often through tests like the modulation transfer function (MTF), which characterizes the system's spatial frequency response. Why is an incident reporting system critical in radiology, and what key elements should be included in such a system to ensure effective patient safety and quality control? Answer: an incident reporting system is critical in radiology for the following reasons: enhances patient safety. By documenting adverse events or near misses, facilities can identify trends and implement corrective actions to prevent future occurrences. Fosters a culture of safety, encouraging reporting without fear of punishment. Creates an environment where staff feel comfortable sharing their concerns, leading to overall improvement in quality. Regulatory compliance. Many accrediting bodies and regulatory agencies require incident reporting as part of their safety standards, ensuring that facilities comply with national guidelines. Continuous improvement. Analyzing reported incidents provides valuable data for improving protocols and training, ultimately enhancing the quality of care. Key elements of an effective incident reporting system include clear definitions, clearly define what constitutes an incident, ensuring that all staff understand what should be reported. User-friendly reporting tools. Implement an easy-to-use electronic reporting system that allows for quick submission and tracking of incidents. Confidentiality assurance. Ensure that reports are confidential to protect the identities of individuals involved. Feedback mechanisms. Provide feedback to staff regarding the outcomes of reported incidents to foster trust and transparency. Regular review processes. Establish regular reviews of incident reports by a safety committee to analyze trends and recommend improvements. These components contribute to a robust system that promotes patient safety and quality assurance in radiology departments. What specific protocols should radiology departments implement to ensure patient safety during imaging procedures, and how do these protocols align with national safety standards? Answer: radiology departments should implement the following specific protocols to ensure patient safety. Pre-procedure screening. Conduct thorough pre-procedure assessments to identify any contraindications for imaging, such as allergies to contrast media or potential risks associated with the patient's medical history. Radiation dose optimization. Implement protocols to adhere to the ALARA principle by optimizing imaging techniques and using appropriate shielding to minimize radiation exposure to patients. Informed consent procedures. Ensure that patients are adequately informed about the risks and benefits of the procedure, particularly when using contrast agents or involving radiation exposure. Monitoring during procedures. Maintain monitoring systems during procedures to track patient reactions to contrast agents or other interventions, allowing for immediate response to adverse events. Post-procedure follow-up. Establish follow-up protocols to check on patients post-imaging, particularly those who received contrast, to address any delayed reactions or complications. Discuss the critical components of a quality assurance program in a radiology department and how these components contribute to improved patient outcomes and compliance with regulatory standards. Answer: the critical components of a quality assurance program in a radiology department include quality control procedures, routine checks and balances for imaging equipment to ensure optimal performance and accurate results. This includes regular calibration and maintenance, staff training and competency, continuous education programs that ensure staff are knowledgeable about the latest practices, technologies, and safety standards contributing to better imaging quality and patient care. Data collection and analysis. Systematic collection of data on imaging outcomes, incident reports, and quality metrics, enabling departments to identify areas for improvement and track progress over time. Patient feedback mechanisms. Implementing processes to gather patient feedback regarding their experiences, which can help identify areas needing enhancement and promote patient-centered care. Regulatory compliance monitoring. Regular audits to ensure compliance with national and international regulations and standards, reducing the risk of penalties and enhancing the facility's reputation. In a context of informed consent, what are the key elements that a radiological technologist must ensure before proceeding with a radiological procedure? Discuss the legal implications of inadequate informed consent. Answer: informed consent is a fundamental ethical and legal obligation in healthcare, particularly in radiology. The key elements include disclosure. Patients must be provided with adequate information regarding the procedure, including its purpose, risks, benefits, and alternatives. This ensures that patients can make informed decisions. Comprehension. The patient must understand the information provided. The technologist should assess understanding through open-ended questions and clarify any doubts. Voluntariness. Consent must be given freely without coercion. Patients should feel comfortable asking questions and expressing concerns. Competence. The patient must have the capacity to make informed decisions, which means being mentally competent to understand the implications of the procedure. Legal implications of inadequate informed consent may include malpractice claims, as patients could argue that they would have opted out of the procedure had they been fully informed. Regulations like the Health Insurance Portability and Accountability Act (HIPAA) in the United States emphasize the importance of patient autonomy and informed decision-making. Describe the importance of effective communication skills in patient management for radiological technologists. Provide examples of strategies that can enhance communication with patients from diverse backgrounds. Answer: effective communication is crucial for building trust, ensuring patient comfort, and improving overall outcomes in radiological practice. Key points include understanding needs. Listening actively to patient concerns helps technologists understand their needs, reducing anxiety and ensuring cooperation during procedures. Tailoring communication. Technologists should adapt their communication styles based on the patient's background, language proficiency, and cultural factors. For instance, using simple language or visual aids for patients with low health literacy can enhance understanding. Building rapport. Establishing a connection through empathy and respect fosters a supportive environment. Greeting patients warmly and introducing oneself can make a significant difference. Use of technology. Utilizing translation services or apps for non-English speaking patients can bridge communication gaps. Strategies to enhance communication include cultural competence training, which equips technologists with skills to navigate interactions with patients from diverse backgrounds, thereby improving patient satisfaction and compliance with procedures. During a contrast-enhanced imaging procedure, a patient exhibits signs of an allergic reaction. Outline the steps the radiological technologist should take in accordance with emergency protocols. Answer: in the event of an allergic reaction to contrast media during imaging, the radiological technologist should follow these steps. Recognize symptoms. Be vigilant for symptoms such as rash, difficulty breathing, or swelling. Immediate recognition is crucial. Stop the procedure. Cease all imaging activities to prioritize the patient's safety. Alert medical staff. Notify a physician or emergency response team immediately. Communication should be clear regarding the nature of the reaction. Monitor vital signs. Assess the patient's vital signs, pulse, blood pressure, respiratory rate, and stay with the patient to provide reassurance. Administer first aid. Depending on the severity, administer first aid as appropriate, e.g., antihistamines for mild reactions or epinephrine for severe anaphylaxis under the guidance of a physician. Document the incident. After stabilization, document the event accurately in the patient's record, detailing the reaction, steps taken, and any medications administered. Following established emergency protocols is vital for minimizing risks and ensuring patient safety in the imaging department. Discuss the role of radiological technologists in the research and development of new imaging technologies. What ethical considerations should they be aware of when participating in clinical trials? Answer: radiological technologists play a pivotal role in the research and development of new imaging technologies by data collection, assisting in the collection of data during clinical trials, ensuring accuracy and consistency in imaging procedures, protocol implementation, adhering to study protocols, and assisting researchers in executing imaging procedures according to established guidelines, patient interaction, educating patients about the trial process and obtaining informed consent, ensuring they understand their rights and the study's nature. Ethical considerations include patient safety, prioritizing patient welfare by ensuring that new technologies are tested in accordance with ethical guidelines, minimizing risks, confidentiality, upholding patient confidentiality and privacy throughout the research process in compliance with regulations like HIPAA, conflict of interest, being transparent about any potential conflicts of interest that may affect their role in the research. Mr. Tanaka is a radiological technologist who has been asked to implement an artificial intelligence (AI) system in the imaging department to assist in diagnostic imaging. What are the primary considerations Mr. Tanaka should keep in mind when integrating AI technologies into clinical practice? Answer: when implementing AI technologies in clinical practice, Mr. Tanaka should consider the following. Validation of AI tools. Ensure that the AI system has undergone rigorous validation and has demonstrated accuracy in clinical trials. Familiarity with the algorithms and their limitations is crucial. Training and familiarization. Technologists should receive proper training on the AI system's functionalities to leverage its capabilities effectively while maintaining high standards of patient care. Integration with existing workflows. Assess how the AI technology fits into current workflows, ensuring that it enhances rather than disrupts patient care processes. Regulatory compliance. Familiarize himself with relevant regulations, such as the Medical Device Regulation (MDR) in the EU, which governs the use of medical devices, including AI applications. Ethical considerations. Address ethical concerns related to AI, such as the potential for bias in algorithms and the need for transparency in decision-making processes. Patient interaction. Maintain the human touch in patient interactions, using AI as a tool to assist rather than replace personal engagement. What criteria should radiological technologists use to evaluate the validity of research studies in radiology? Discuss the importance of these criteria in clinical practice. Answer: radiological technologists should assess the following criteria when evaluating the validity of research studies. Study design. The design, e.g., randomized controlled trials, cohort studies, significantly impacts the reliability of the results. Well-structured studies tend to yield more valid conclusions. Sample size. A sufficiently large sample size enhances the power of the study, reducing the likelihood of random error and increasing the generalizability of the findings. Bias assessment. Evaluate potential biases, such as selection bias or reporting bias, which can distort study outcomes. Understanding how biases are addressed in the study is crucial. Outcome measures. The relevance and reliability of the outcome measures used should be assessed. Validity ensures that the measures accurately reflect the constructs being studied. Peer review. Consider whether the study has undergone peer review, which adds a layer of scrutiny by experts in the field. Understanding these criteria helps technologists integrate evidence-based practices into clinical settings, ensuring that patient care decisions are informed by reliable and valid research findings. Why is cultural competence essential for radiological technologists when interacting with patients? Provide examples of how a lack of cultural competence can impact patient outcomes. Answer: cultural competence is essential for radiological technologists for several reasons. Patient trust. Demonstrating respect for cultural differences fosters trust between the technologist and patient, which is vital for effective communication and cooperation during procedures. Improve compliance. Culturally competent care encourages patients to follow medical advice and recommendations, improving compliance with imaging protocols, reduce disparities. Understanding and addressing cultural factors can reduce health disparities among diverse populations, ensuring equitable access to imaging services. Examples of the impact of a lack of cultural competence include miscommunication. A lack of understanding of a patient's cultural beliefs may lead to misunderstandings about the purpose of the procedure, causing anxiety or refusal to undergo necessary imaging. Stereotyping. Generalizing assumptions based on a patient's cultural background can lead to biases in care, negatively affecting patient experiences and outcomes. What are the implications of emerging technologies, such as 3D printing and augmented reality, for the practice of radiological technologists? Discuss the potential benefits and challenges of these technologies. Answer: emerging technologies like 3D printing and augmented reality have significant implications for radiological practice. Enhanced visualization. 3D printing allows for the creation of physical models from imaging data, improving surgical planning and patient education. AR can overlay imaging data onto real-world views, aiding in precise localization during procedures. Personalized medicine. These technologies enable tailored treatment plans based on individual patient anatomy, potentially leading to better outcomes and patient satisfaction. Training and education. AR can be used for training purposes, allowing technologists to simulate procedures and improve their skills in a controlled environment. However, challenges include cost and accessibility. Implementing these technologies may require significant investment and training, which could be a barrier for some institutions. Regulatory concerns. As these technologies evolve, ensuring compliance with regulatory standards becomes essential to maintain patient safety and care quality. Identify and explain the ethical considerations radiological technologists must be aware of when involved in clinical research. How can adherence to ethical guidelines enhance the quality of research? Answer: when involved in clinical research, radiological technologists must be aware of several ethical considerations. Informed consent. Ensuring that participants understand the research purpose, risks, and benefits is crucial. This promotes autonomy and respects the participants' rights. Confidentiality. Protecting patient information and maintaining confidentiality is essential to build trust and comply with regulations such as HIPAA. Risk-benefit analysis. Assessing the potential risks versus the benefits of the research ensures that the welfare of participants is prioritized and unnecessary harm is avoided. Fair participant selection. Ensuring equitable selection of participants helps prevent exploitation of vulnerable populations and promotes fairness in research. Integrity of data. Adhering to ethical guidelines helps ensure the integrity of the data collected, enhancing the reliability and credibility of the research findings. Adherence to these ethical principles enhances research quality by ensuring that studies are conducted responsibly and that the rights and welfare of participants are protected. What are the essential emergency protocols that radiological technologists should follow in the event of a patient collapse during an imaging procedure? Discuss the importance of these protocols in ensuring patient safety. Answer: in the event of a patient collapse during an imaging procedure, radiological technologists should follow these essential emergency protocols. Immediate assessment. Quickly assess the patient's responsiveness, airway, breathing, and circulation acts. This initial assessment guides the urgency of interventions required. Call for help. Activate the facility's emergency response system by calling for additional medical assistance. Clearly communicate the situation to the responding team. Positioning. If the patient is unresponsive, carefully position them to ensure an open airway. If necessary, begin CPR if the patient is not breathing, monitoring vital signs. Continuously monitor vital signs and be prepared to provide information to emergency responders upon their arrival. Documentation. After stabilizing the patient, Document the incident accurately, including the circumstances leading to the collapse and any interventions performed. These protocols are vital for ensuring patient safety and minimizing complications. They enable rapid and effective response to medical emergencies, demonstrating the technologist's readiness to manage unforeseen situations while prioritizing patient care. In radiological practice, how should a radiological technologist handle a situation where a family member of a patient requests information about the patient's imaging results? Discuss the ethical and legal considerations involved. Answer: a radiological technologist must prioritize patient confidentiality and privacy as mandated by laws such as the Personal Information Protection Law (PIPL) in Japan. The technologist should adhere to the principle of patient autonomy, ensuring that information is disclosed only with the patient's consent. The relevant guidelines include patient consent. The technologist should inform the family member that, due to ethical considerations and legal regulations, they cannot disclose any information without the patient's explicit consent. HIPAA guidelines, if applicable. While HIPAA is a U.S. regulation, its principles emphasize protecting patient information, which can serve as a reference in ethical decision-making. Professional codes of ethics. The Japan Radiological Technologists Association JAT emphasizes confidentiality as a core ethical duty, reinforcing that patient information should only be shared with authorized personnel. Failure to adhere to these principles could lead to legal ramifications, including potential malpractice claims for breaches of confidentiality. What steps should a radiological technologist take if they suspect that a physician is ordering unnecessary imaging studies for a patient? Discuss the ethical implications and potential consequences of their actions. Answer: if a radiological technologist suspects that a physician is ordering unnecessary imaging studies, they should follow these steps. Documentation. The technologist should carefully document their observations, including the rationale for the imaging request and any relevant patient history that raises concern. Communication. The technologist should communicate their concerns directly to the physician in a non-confrontational manner. This could involve discussing the medical necessity based on established guidelines, such as the American College of Radiology (ACA) appropriateness criteria. Reporting. If the concerns are not addressed satisfactorily, the technologist should escalate the issue to the department head or relevant ethics committee within the institution. They may also refer to regulatory guidelines established by the ICRP, which emphasize the necessity of justifying medical exposures. Ethical reflection. The technologist should consider the ethical implications of their actions. The principle of non-maleficence, avoiding harm, suggests that reporting unnecessary procedures is crucial to protect patient welfare. Failure to address the situation could lead to unnecessary patient exposure to radiation, potential legal consequences for the physician, and ethical dilemmas for the technologist regarding their professional responsibilities. Explain the concept of negligence in the context of radiological practice. What are the key elements that must be established to prove negligence, and how can radiological technologists mitigate their risk of being accused of malpractice? Answer: negligence in radiological practice occurs when a radiological technologist fails to meet the standard of care expected in their professional duties, leading to harm to the patient. To prove negligence, the following key elements must be established. Duty of care. The technologist must have had a professional duty to provide care to the patient. Breach of duty. The technologist failed to act according to the established standards of practice, e.g., not following proper protocols for patient safety. Causation. There must be a direct link between the breach of duty and the harm caused to the patient, e.g., a misdiagnosis resulting from improper imaging techniques. Damages. The patient must have suffered actual harm or injury as a result of the negligence. To mitigate the risk of malpractice claims, radiological technologists should adhere to protocols, follow established imaging protocols and best practices to ensure high-quality patient care. Documentation. Maintain accurate and thorough documentation of patient interactions, imaging results, and adherence to protocols. Scenario. Mr. Zanaka, a 45-year-old patient, has been referred for a CT scan to evaluate abdominal pain. During the procedure, the radiological technologist notices a suspicious lesion that could indicate a serious health condition. However, the physician has not ordered additional imaging for further evaluation. What should the radiological technologist do in this situation? Question: what actions should the technologist take in light of the findings, and what ethical and legal responsibilities come into play? Answer: in this scenario, the radiological technologist should take the following actions. Immediate reporting. The technologist should immediately report their observations regarding the suspicious lesion to the referring physician. This is crucial to ensure that the physician is aware of any potential risks to the patient's health. Documentation. The technologist should document their findings and the actions taken in the patient's imaging record. This includes details of the lesion and any relevant clinical information that supports the need for further evaluation. Professional judgment. If the physician is unavailable or dismisses the concern, the technologist may consider escalating the matter to the department supervisor or a radiologist for a second opinion. The ethical principle of beneficence acting in the best interest of the patient is paramount here. Legal considerations. Failure to report significant findings could result in legal liability for both the technologist and the physician if the patient suffers harm as a result. The legal standard requires the healthcare professionals act in accordance with their duty of care, which includes communicating critical findings promptly. Discuss the significance of international standards in radiology, particularly those set by the International Commission on Radiological Protection (ICOP) and the National Council on Radiation Protection and Measurements (SRP). How do these standards influence radiological practices in Japan? Answer: international standards set by organizations such as the ICRP and NCRP play a critical role in ensuring safe and effective radiological practices. Their significance includes safety protocols. The ICRP provides recommendations for radiation protection, emphasizing the need to minimize exposure to patients and staff while ensuring that the benefits of imaging outweigh the risks. These guidelines help establish safety protocols in radiological practices. Regulatory compliance. The NCRP outlines standards for radiation protection and measurement, which influence regulatory frameworks in various countries, including Japan. Compliance with these standards is essential for maintaining public health and safety. Quality assurance. Both organizations promote quality assurance in radiological practices, encouraging continuous improvement and adherence to best practices. This is particularly important in Japan, where the Japan Radiological Technologists Association JA incorporates these international standards into their own guidelines. Training and education. The standards serve as a basis for the education and training of radiological technologists, ensuring that they are well equipped to handle complex imaging technologies and adhere to safety protocols. What are the key components of professional conduct expected from radiological technologists? Discuss how these components contribute to the overall quality of patient care. Answer: the key components of professional conduct expected from radiological technologists include competence. Radiological technologists must possess the necessary skills and knowledge to perform imaging procedures safely and effectively. This includes ongoing education and adherence to best practices. Integrity. Technologists should demonstrate honesty and ethical behavior in all aspects of their work, including reporting results and interactions with patients and colleagues. Confidentiality. Maintaining patient confidentiality is crucial in building trust and ensuring compliance with legal regulations such as the PIPL in Japan. Respect for patients. Technologists should treat all patients with dignity and respect, considering their individual needs and preferences during imaging procedures. Collaboration. Effective communication and collaboration with healthcare teams are essential for providing comprehensive care to patients. Technologists should work closely with physicians and other healthcare professionals to ensure accurate diagnosis. These components contribute to the overall quality of patient care by fostering a professional environment that prioritizes patient safety, trust, and satisfaction. By adhering to high standards of conduct, radiological technologists can enhance the effectiveness of imaging services and support positive patient outcomes. Identify the primary regulatory bodies governing radiological practices in Japan. Discuss their roles and the impact of their regulations on the practice of radiology. Answer: the primary regulatory bodies governing radiological practices in Japan include Ministry of Health, Labour and Welfare (RWDM). HLW oversees healthcare policies and regulations in Japan, including those related to radiology. They establish guidelines for radiation safety, healthcare standards, and the licensing of healthcare professionals. Japan Radiological Technologists Association (JA). JART sets professional standards for radiological technologists, providing guidelines on best practices, ethics, and education. Their influence ensures that technologists maintain a high level of competence and adhere to ethical principles. Japanese Society of Radiological Technology (JRT). JSRT promotes research and education in the field of radiology, advocating for advancements in imaging technologies and practices. They play a vital role in shaping the curriculum and training programs for radiological technologists. National Institute of Radiological Sciences NIRS conducts research on radiation effects and safety, contributing to the development of policies and guidelines that protect patients and staff from radiation exposure. The impact of these regulatory bodies on the practice of radiology includes the establishment of standards for training and certification, implementation of safety protocols, and the promotion of ethical practices. Their regulations help ensure that radiological services are delivered safely and effectively, ultimately enhancing patient care. Why is continuous professional development, CPD, essential for radiological technologists? Discuss the implications of inadequate CPD on patient care and the professional standing of technologists. Answer: continuous professional development. CPD is essential for radiological technologists for several reasons. Keeping abreast of technological advances. The field of radiology is constantly evolving with new imaging technologies and techniques. CPD ensures that technologists remain knowledgeable about the latest advancements, enabling them to provide the highest quality of care. Enhancing skills. Ongoing training helps technologists refine their skills, learn new procedures, and adopt best practices. This is crucial for maintaining competency and ensuring patient safety. Adhering to standards. Many regulatory bodies require CPD as a condition for maintaining licensure or certification. Failure to participate in CPD can result in loss of certification and inability to practice legally, improving patient outcomes. Well-trained and knowledgeable technologists are better equipped to identify and respond to patient needs, leading to improved diagnostic accuracy and enhanced patient safety. Inadequate CPD can have severe implications for patient care, including increased risk of errors. Lack of current knowledge may lead to outdated practices, resulting in misdiagnosis or inadequate patient care. Legal and ethical consequences. Failure to meet professional standards due to insufficient training can lead to malpractice claims and damage to professional reputation. Overall, CPD is critical for ensuring that radiological technologists maintain high standards of practice, ultimately safeguarding patient welfare and enhancing the quality of healthcare delivery. Analyze the importance of compliance with legal standards in radiology. What are the potential consequences of non-compliance for radiological technologists and healthcare institutions? Answer: compliance with legal standards in radiology is crucial for several reasons. Patient safety. Legal standards, such as those established by the ICRP and NCRP, are designed to protect patients from unnecessary radiation exposure. Adhering to these standards ensures that imaging procedures are justified and performed safely. Legal protection. Compliance with regulations protects radiological technologists and healthcare institutions from legal liabilities. Following established protocols reduces the risk of malpractice claims and legal action in cases of patient harm. Public trust. Adhering to legal standards fosters public trust in the healthcare system. When patients are assured that their safety is prioritized through compliance with regulations, they are more likely to seek necessary care. Quality assurance. Legal standards often incorporate quality assurance measures that enhance the effectiveness and reliability of imaging services. The potential consequences of non-compliance for radiological technologists and healthcare institutions include legal repercussions. Non-compliance can lead to lawsuits, fines, and penalties imposed by regulatory bodies, impacting the financial stability of healthcare institutions. Professional sanctions. Technologists may face disciplinary actions, including suspension or revocation of licensure, which can severely impact their careers. Increased risks. Non-compliance can result in adverse patient outcomes, including misdiagnosis and unnecessary procedures, leading to physical harm and loss of patient confidence. Overall, compliance with legal standards is essential for ensuring safe and effective radiological practices, protecting patient welfare, and maintaining the integrity of the healthcare profession. Discuss the ethical considerations a radiological technologist must navigate when dealing with pediatric patients. How can they ensure that ethical principles are upheld while providing care? Answer: when dealing with pediatric patients, radiological technologists must navigate several ethical considerations. Informed consent. Obtaining informed consent for imaging procedures is crucial, especially when dealing with minors. The technologist must ensure that parents or guardians are fully informed about the procedure, potential risks, and benefits, adhering to legal and ethical guidelines. Minimizing radiation exposure. The principle of ALARA as low as reasonably achievable is paramount in pediatric imaging. Technologists must use appropriate techniques to minimize radiation exposure while obtaining high-quality images. Communication. Effective communication with both the patient when appropriate and their guardians is essential. Technologists should explain the procedure in age-appropriate language to alleviate anxiety and ensure cooperation. Cultural sensitivity. Understanding the cultural and social backgrounds of pediatric patients is important in providing respectful and appropriate care. This includes considering cultural beliefs and practices related to healthcare. To ensure that ethical principles are upheld while providing care, radiological technologists can engage in continuing education, stay updated on pediatric imaging guidelines and best practices to ensure safe and effective care, consult with colleagues, collaborate with pediatric radiologists and other healthcare professionals to ensure comprehensive and ethical care for young patients, advocate for the patient, act in the best interest of the pediatric patient, advocating for their safety and well-being throughout the imaging process. By prioritizing these ethical considerations, radiological technologists can provide compassionate and responsible care to pediatric patients while upholding the highest ethical standards in their practice.